Hey everybody, it's Evan and Irma here with an interesting discussion with Mitel, the global communications and collaboration powerhouse. Ryan, how are you?
I'm doing great. How are you, Evan? Irma, how are
I'm
you?
I'm doing great. A little chilly up here in Boston, but we'll get through it as we always do. Many of my audience, my followers, know of Mitel, of course, a long history, very storied company, lots of activity going on, but fewer perhaps are familiar with the work that you do in healthcare, serving hospitals and healthcare systems globally. So we're going to do a deep dive today. Maybe introduce yourself, Ryan, and your team, and maybe Mitel. You're a company that's growing and changing a lot these days.
Yeah, absolutely. Hey, thank you again for having me. Grateful for the invite, and I love the community you've built. So I'm excited to be a participant today. A little bit about myself. So I join you from Austin, Texas, where my wife and I raised three young boys. So I have a front row seat to healthcare every day, as you can imagine. Um, but I joined the Mitel family just about 12 years ago via the ShoreTel acquisition. And so during my time here, I've led multiple teams and initiatives, including cloud strategies. And currently, I'm focused on our focus in healthcare, and I lead that strategy here in the U.S. As you know, Mitel is a global company, and healthcare is a vertical focus globally. But I do spend my time and energy really better understanding the needs of healthcare here in the States and ensure our solutions are aligned to the market needs.
Fantastic. And I think, Irma, we're going to start. You have a question for Ryan.
Well, of course. So I am curious how unified communications are making a difference in hospitals and clinics today for those that are not familiar. And obviously, it's helping doctors, I'm assuming, nurses. What about patients? Do patients benefit as well?
Yeah, so it's a great question. And really, I mean, unified communications plays just such a critical role in improving the patient experience. So whether that's, well, one thing I would say is that there's so much talk today about us all being more proactive in our own health. So when engaging providers, unified communications really are the tools that enable us to do so.
Mm.
On the provider side, they can more effectively meet us where we are in the forms of communication that we prefer, whether that's still picking up the phone and communicating via voice, whether that's text, whether that's self-service. So these tools lead to that ideal patient experience and produce better clinical outcomes ultimately, right? As a result, which ultimately leads organizations to grow revenue, which obviously is critical to their business. But yes, UC is kind of at the center of how we as consumers and patients get to interact with something so important like our healthcare provider.
Yeah, great point. And there's so much transformation needed in healthcare IT. We had a loved one in the hospital late last year, actually, and the bedside telephone was like something from the 1960s. I couldn't figure out how to use it. My mother couldn't figure out how to use it. I don't think it made calls. I mean, there's a lot of catching up to do that needs to happen around communications and health IT. How are you helping with, modern applications and endpoints like phones? We still use phones and collaboration communications in general. Talk about the big refresh that kind of needs to happen.
Yeah, so you're right. I mean, the tools, the technology, it has changed so much, right? In terms of how we're able to interact, how we're able to self-serve.
Mm.
But some of that, that bedside terminal is still there. Believe it or not, right? Actually, funny story. There was a provider who was looking to put in a new terminal and create a new experience, but it's hard to believe those tools are still there, and that ability to be able to phone your family from the bed is still a need. And so I think what you're highlighting is a really important piece. Is there's so much evolution and technology and innovation that's taking place, but some of that core infrastructure is still there. I think that's really where Mitel looks to have the right conversations with these providers and provide flexibility to bring technology into all those specific use cases. Where I'd say we're really, focused on is it all starts with the questions, right? So identifying patients' needs, customer staff needs, where their workflows, and bringing the right technology to it. And Mitel does offer a lot of different solutions in that environment. So as technologists, we're focusing on developing products that bring together a suite of solutions that touch all aspects of the healthcare provider communication strategy. So things such as the contact center. And this obviously includes everyone's favorite topic today, which is AI. But where can AI bring in, secure automation? We want to focus on the contact center and integrations with the EHR, right? So how do you provide a better patient experience, improve important KPIs like hold times and average talk times, enhance patient portals, for example, bring chat functionality into the patient portal, real-time interaction with staff while in that portal experience. Mitel is known for its devices, right? So we do manufacture our own phones. What I've seen, within the healthcare environment is not just desk phones that provide, guests experiences and nursing staff behind the desk, but really mobile handsets, I'd say, is something that's a great area of focus. Whether it's Wi-Fi enabled devices for medical staff or SIP decked, right? We also want to create handsets that fit perfectly into the healthcare environment. So antimicrobial treated phones to help cut back on an environment that unfortunately is kind of riddled with bacteria and such. So antimicrobial is a great fit for devices in that environment. But to keep going down the list, video platform and collaboration tools, nurse call integrations is something that's of great importance in that environment. Patient notifications, sending text alerts and reminders to patients that they have an upcoming appointment. Mass notification platforms for patient and safety staff. And then, virtual care collaboration is obviously a really important area as well. So where can we save patients' time? Where can we save medical staff time so that they don't necessarily have to come on site? They can actually have e-consultations, having doctors provide, feedback while remote, keep you safe at home. So as you can see, Mitel really does have services that touch on every aspect of the provider's business. But what's most important is to have those conversations, identify where their needs are so that we can keep developing the right technology to meet those needs.
Well, sounds like a lot of exciting advanced technology, including AI, which is the hot topic these days. But I wanted to go back to what Evan mentioned, the bedside telephone and telephone in general. As a patient myself and as a patient advocate, we talk about patient voice. So from patient voice to the actual technology, all technology of voice communications. Can you talk about how that might still be part of the whole puzzle, especially for those people who might not have access to smartphones, maybe in internet? Is voice still important?
It is. And I think what's really important to identify is the multiple demographics that providers serve, right? And so we talk a lot about, when working with our customers is really make sure that you've identified the demographics that you serve and that you bring in the right technology to meet those needs. So what we see largely is that the elderly community still prefer voice, right? But in any demographic, they're just folks who still want to talk to somebody, right? So at the end of the day, voice is still very much alive, right? And I think it goes beyond that, though, in terms of it just comes down to communication and making sure that customers can meet those patients wherever they are in any form of that communication. So something we really pride ourselves on is choice. So how do you want to deliver that voice? Is it through cloud? Is it through premise? Is it a hybrid model? And what does your footprint look like? Are you
Hmm.
servicing patients in multiple locations? And how do you create a seamless experience through all those modes of communication? So to answer your question shortly, voice is still very much alive. It's and still a preferred form of communication. Then the question becomes is how do you want to deliver it? How do you want to support that voice? Is it in-house amongst your own team? Is it in the cloud, in a virtual environment? So we really pride ourselves on giving providers choice in terms of how they want to deliver that voice communication.
Good to know.
Fascinating. Well done. You mentioned so much there, from voice to video to collaboration, unified communications, messaging, different apps that might live on mobile devices, wireless phones. I mean, how do you start with a client, a hospital or healthcare system? How do you kind of go in and evaluate their needs? There's so much complexity and integration and kind of technical debt, what we call it, of
Yeah.
legacy out there. Walk us through the process.
So, like I said earlier, I mean, number one is I think what's incredibly important is that providers know that they have help, right? That they have solutionists, that they have technologists who can help them. And what's important to note too is that every provider is just a little different. I know we talk a lot about healthcare as a vertical as a whole.
Hmm.
But even within healthcare, there's a lot of sub verticals, right? I think last time I counted, there's north of 15 different sub verticals. So you have clinics, you have hospitals, you have long-term care facilities, you have addiction treatment centers. So everyone's needs are very unique. And so I think when they partner with someone like Mitel, and I should say also we're a manufacturer, right? So when we
Hmm.
work with customers, we also use our partner community who work alongside us to actually come in and deliver those solutions.
Mm.
But it all starts with the conversation: is what is your strategic goal as it relates to communication? What does that patient experience, that ideal patient experience, look like for you as a provider? And where are the pain points? Where is staff not as efficient as you want them to? Or, you know, what is the something that you're struggling with each and every day? So, just as an example, I've had multiple calls recently that their biggest pain point is that Monday morning comes, someone was injured over the weekend,
Hmm.
so they're got 15,000 calls Monday morning, but they have limited staff, right? And so they have trouble getting more recruitment into their call center, as an example. And so the question really is about where does automation, where does technology, where could AI help fill some of those pain points and those gaps? So it's really just through conversation and identifying those needs and bringing the right solutions. And then from there, once we've established that trust and we kind of continue to educate them and share all that is possible, that's when we really have a roadmap. And that's why Mitel really is kind of known for its large base of existing customers and how we continue to grow along with our customers. So that's a big area of focus, is optimizing the technology that they have in their environment today, finding new opportunities and new areas to bring tech and be a part of their longer term journey.
Um,
Fantastic.
Interesting. So, Ryan, you mentioned there is more than a dozen different verticals within healthcare.
Yes.
You might only think about, acute, post-acute care, and not necessarily consider the big variety of different ways we receive care. Could you perhaps mention a few clients, maybe, or a couple clients in each vertical, or at least some bigger verticals for you, and maybe we'll recognize some of these names just to know who you might be powering behind the scenes, because as a technology provider, we as patients and patient advocate might not even consider who's making all this possible, this communication.
Yeah,
Um,
that's a great question. So within some of the sub verticals, for example, we have long-term care facilities. So Sunrise Senior Living Facility is one I've mentioned that kind of have a large growing footprint. There's also Horizon, who is also in the long-term care facility. And then we work with some really large hospitals. So one that comes to mind recently that is moving its platform from a legacy system over to Mitel is Centra Health, a long-term customer of ours as well, is part of the Optum umbrella or United Health Group umbrella, which is Optum Serve, which is a branch within that umbrella that really focuses on government contracts. Some others that come to mind, of course, is part of the Texas Oncology is an existing customer of ours. And then I recently just got back from a trip to Florida where I met with Florida Medical Clinics, which manage over 50 different locations within Florida. So, what's so interesting about the conversations, they're all in very different spaces, as I mentioned earlier. So it's great to work with, large hospital systems that are kind of big buildings that have specific needs within those walls. And then a Florida Medical Clinic that's just managing multiple different physician sites, or even the long-term care facilities that have specific unique needs within one facility, but have a much larger footprint. So kind of have a formula, if you will, to providing a solution that can scale across multiple locations.
Oh, fantastic work. I had no idea. So Mitel's undergone a lot of transformation and growth change, particularly with the Atos Unify acquisition that went through recently. So you have a huge footprint now in Europe. Tell us about the global marketplace. You spend a lot of time on planes?
I'm fortunate enough to do all my plane travel here in the US. So I do not have to spend too much time overseas, but we do collaborate quite a bit with our peers across the pond, or even our friends down under as well. And again, it's really about making sure we're consistent with the Mitel story, and that we are helping everyone and educate everyone on the great technology and the solutions that we have. And so what's interesting is obviously healthcare here in the States is very different from healthcare overseas, right? In some ways, in our kind of multiple vertical strategy overseas, healthcare and government, right, going to go hand in hand. And so I think that Mitel really has aligned to the right vertical strategies, and there's a lot of synergy between the different verticals. So here in the States, you could argue that hospitality and healthcare can leverage some of the same solutions and stories. And overseas, you obviously, like I said, have healthcare and government being a little bit more combined. So there's a lot of global collaboration. You mentioned, Unify. So naturally, there's a lot of planning and discussions about how to go onward and upward from here. So it's going to be a very exciting and busy 2024. And, we have our sales kickoff coming up soon, and some partner events to help educate customers as well as our partners on how to be successful moving forward and where the right area of focus is for everyone.
That's a great segue to my next question, which is about finding out more about Mitel. So obviously your clients and users already know, and I'm glad that you spend resources and time to educate them more and empower them more. What about those that haven't been exposed to your solutions yet? Are you going to be presenting at large conferences like HIMSS or other smaller events? And what else is exciting for you? And where can we meet you, or who should we contact this
Yeah.
year to learn more?
No, thank you for that question. So first and foremost, if anyone wants to reach out to me, by all means, please reach out via LinkedIn. I'd love to talk with any providers who are thinking about their solutions and just want to collaborate and learn a little bit more. So that's how you can get in touch with me. For those less familiar with some of Mitel's solutions, of course, please go to mitel.com. Within there, you'll find solutions by vertical. So you can go to the healthcare solutions section, learn more about our MSA partners, learn more about our solutions and how they all come together. And then, yes, we're kind of currently planning and working on where to find us out in the market. And I think that's a really important strategy moving forward, is just to make sure we're coming to you, right? That we're meeting you within your geography. And obviously we have our territory resources who are all kind of closely aligned, but we want to find, more events. We want to find just more opportunities to proactively share the story, share the solutions, and present the capabilities, because I think there's a lot that people are looking for. And again, those conversations, like we were saying earlier, are so key to really making it unique to what they're looking for. So hopefully I'll get a chance to meet many new folks out in the market in their own environment.
Fantastic. Well, come up to Boston. We have a lot of healthcare companies here in the area, so I'm sure you can help many of them. What else are you excited for this year beyond the kickoff? I imagine you have a lot of travel and other things on your calendar.
Yeah, I mean, at this point, I think it's just we have some great engagements going, and we have just some customers just really really excited about the opportunity ahead, right? I think there's just there's a lot of focus. We mentioned AI earlier, but really, I mean, when you kind of strip that all back, I think there's just some great conversations. I think folks are really starting to get organized around their own strategic plans. So what's really fun about that is once they've kind of identified where they go from here, that gives us a chance to come in and help talk about the fun stuff, right? Of the solutions that kind of align to those specific needs. So that's what I'm looking forward to, is just more and more conversations with more and more providers, and find a way to really impact the patient experience and help these staff, alleviate some of the difficult tasks and get back to what they're doing best, which is providing care for the three of us and everyone else.
Fantastic. Well,
Yeah,
thanks so
speaking of the
much.
experience, yeah, you should really try to break into the Boston area here and power one of our big healthcare systems today. Is really frustrating me because I got a message that there is a important test result is on the portal, except that portal is overwhelmed and I can't get to the result. And I got a note that there is something that they saw that was wrong and I need to follow up, except I can't read the whole note. So they're leaving me hanging. And it makes me think about reliability of the underlying technology and how technology needs to grow to meet the growing demand. Now that the patients have gotten the taste of going on the portal, see their results, then that needs to be a reliable experience, and then not leave patients hanging and anxious, quite frankly, to get those results. So yeah.
We'll have to we'll touch base offline, and you'll have to share which provider you're seeing, and give them,
yeah, I won't mention the name. We only have a couple of really big healthcare systems in the area, so one of them is really feeling me today.
You may be in trouble, Ryan. You may get your entire 2025 feature list from Irma. So this is a very feature request. So this is a very dangerous conversation, but one we want to have. So we'll set aside a few hours for that discussion. But thank you so much for being here, shedding some light on the great work that Mitel is doing in healthcare. And thanks for watching, everyone. Reach out to Mitel. If you're going to HIMSS, reach out to us. We hope to chat with you there. And yeah, thanks for watching. Thanks, Ryan. Thanks, Irma.
Thanks, Ryan. Thanks, everyone.